Hello, it's been a while since I've done a live, and here I am. I'm Jill Stannard. I'm a naturopath and I mentor health professionals in private practice and health related businesses. Today is the 15th of February 2022. I had to think what year it is because these last couple of years have been pretty interesting. I've been meaning to start a live this year since I went back to work in the second week of January. However, it you may hear some noises in the background, and that is because since June 2021, we have had major construction work going on around us. So, like every time I go live, there's noise. There was a little break in the traffic, so I started a live, and of course, there'll be interruptions. I am double screening, so I'm going to live from my City Natural Therapies Facebook business page and Herbal Jill on Insta. And hello, Catherine, and hello. A couple of Melbourne people I know here. So I will save this, of course, to my socials, but it seemed rather remiss of me in this age of you know what for the last 2 years to talk about how you can take care of yourself right now if you are feeling a bit under the weather. Now, this virus keeps changing. Where we're at the moment with this virus is, fortunately, it's shifted from predominantly lower respiratory system symptoms to upper respiratory. And different presentations have different naturopathic supports for them. So what I'm going to talk about today may be current for what's going on in early 2022. It may be relevant for having a cold, and some of it may be even relevant for hay fever, because sometimes all these symptoms can feel like any of those three causes. So one of the things that I'm getting the biggest SOSs about is sore throats. Okay, so of course you've got your painkillers at home, and hello Suzanne. You've got your regular pain, and Debbie. Nice to see you, Debbie. So for those a couple of people who have just recently joined us, I'm just doing a very belated live about taking care of ourselves in the current climate. And the first thing I'm going to talk about that I'm getting the SOSs about are sore throats, very sore throats. People of all ages, when they're coming down with this mystery infection, are getting very sore throats. So of course, go for the painkillers that you need. My go-to conventional painkiller for sore throats, and I'm speaking as someone who had years of recurrent sore throats that then culminated in glandular fever, so I know all about how sore a throat can get. But what always helped me best from the conventional world was actually gargling soluble aspirin. Now, you may or may not have contraindications to do that yourself. If you can't take aspirin internally, then you can always spit it out, but as a local, it can help. In the naturopathic world, one thing that your mum might have told you to do that pretty much everybody has in their house is some salt and warm water. So salt, warm water gargle means, in an average size glass of water, you want to use 1 to 2 teaspoons of sea salt, preferably the straight sea salt, not the free flowing one with additives in it. You dissolve it so it's at body temperature. You don't want it too hot, but if it's cold, it's not going to get the blood flow to the sore parts as easily. So gargle and spit. The point of a gargle is basically to improve your circulation to an area of inflammation. So that will bring bring a bit more blood flow to the area and encourage the blood flow to go out with some of those byproducts of inflammation. So this is palliative. It's something that's not going to be a cure, but it may relieve the symptoms of a sore throat. I'm quite a fan of the manuka and other highly medicinal honeys. So if salt water is not your thing, I would look at using warm water with some of that highly yummy, good manuka style honey as a warm water gargle as well, if you don't like that. One thing that most years I make in my house, and if you go on to jillstarnar.com.au and type in thyme honey, is when I've got a great batch of thyme in the garden ahead of cold and flu season, I will cram a jar with some fresh thyme, but as long as it's not damp, it's dried off, but it's not dried thyme. And then cover that with the best quality honey that I can that I've got, and let it sit for a good month or two. And that is thyme is really antibacterial. I actually have always said that thyme is a thyme tea would be one of the best things you could use to clean your toilet if you didn't want to use chemicals. It's a fantastic antimicrobial. So you can also gargle with thyme tea. Now, if you've got some super dried, sketchy thyme from the supermarket, I probably wouldn't use that. If you've got thyme growing in your garden, get a handful, pour over some boiling water, and let steep in a teapot with the lid on for a good 10 minutes, and then let it cool down to the temperature that is warm for your throat, but not over the top. You don't want it hot. You don't want to burn that sore throat. So if you do have some dried thyme, then the organic and not super old and dusty is worth giving a go as well. Generally, if we're going to make a medicinal tea, we would use half as much dried of a plant than we would fresh. So if I say a handful of fresh thyme, we're talking about more like about 2 teaspoons of dried thyme for maybe 2 cups. So we're gargling, and the gargling is you do every few hours while you have the symptoms to relieve the pain. Obviously, if you have pain to the extent, for any reason that you've got a sore throat, your glands are up like this, or you're having trouble swallowing, you really need to get medical attention fast if you're having trouble swallowing. It's, there are other things like quinsy that can happen, which are major infections of your throat tonsil area that, you need more help than you can get at home. Whenever I have an upper or lower respiratory infection, I like to take medicinal doses of vitamin C. And over the years, what is a medicinal dose of vitamin C, changes a bit. In the past, I've kind of favoured 1,000 milligrams in one hit. These days, I'd like to reinforce what we've always known about vitamin C, is that the more that you take at one time, the less you actually absorb. You're only going to absorb a certain percentage of it. So it's much better to break up your dose through the day, whether it's 250, 500 milligrams. It's just, there's about 1 in 10 to 1 in 20 people who are really sensitive to vitamin C. So if they take a vitamin C supplement of that strength, they're going to get diarrhea. But if you've taken vitamin C before, you'll know whether that's you or not. And of course, tailor your dose. But for the sore throats, even if it's a soluble vitamin C, you can gargle that and swallow it. It's too. I was going to say with the thyme tea, you can gargle that and swallow it as well. So you're getting a local and a more systemic reaction or effect from the medicine. Other symptoms that we're seeing a lot of at the moment are these upper respiratory symptoms, things that you think of as pretty typical of an average cold, but it can make you feel pretty miserable. So if your nose is blocked, I love old-fashioned steam inhalations, and uh, I don't assume that you know what that is. I mean, probably you do. I had an experience with my dad a couple of years ago, taking him to his local doctor, who sent him away with about 14 things to do for his respiratory infection, and one was to have a steam inhalation. So I looked at Dad and I said, "Do you know what that is?" And he went, "No." So basically, you get a bowl of steaming hot water, you get a towel to cover your head, and you can add something to that to help open your airways. Now, if you use an essential oil, more is not better. It's super strong. Just use 1 drop. So if you've got a eucalyptus oil or thyme oil or tea tree oil, 1 drop is enough. So you've got the steaming bowl of water, you've got somewhere safe so you're not going to spill it on you, you've got your towel over your head, and then you're just trying to breathe it in through your nose, trying to open those passages. And your nose might run a bit, so you blow it. And once again, this is kind of palliative. It's not a cure-all. We're trying to help you breathe better. Obviously, if you've got restricted airways, if your breathing problem is down here, not up here, you need to get medical help. So other things that sometimes people have some of those medicated, cold and flu kind of rubby things in their house. Hello, Liz. Nice to see you too. Then, a kind of like a bit of a fingernail full of a vapor rub type product is more than enough. It's going to sting your eyes otherwise. You want to keep your eyes shut, breathe, and just stay there for as long as you can without it becoming uncomfortable. As a herbalist, my favorite decongestant for hay fever, upper respiratory infections, funny viruses that affect your upper respiratory system, colds, is elderflower tea. Now, elderflower is a very delicate, beautiful herb. It's quite pleasant to taste. It's not a yucky tasting herb. If you can find any, organic is best, and that's usually in health food stores that might sell pre-packaged tea, herbal teas, or have them in big jars that they will dispense out. We usually say, like a heaped teaspoon per cup. Brew it in your teapot again. If you don't have a teapot, I quite often make big batches of herbal tea in big coffee plungers, or small coffee plungers for smaller amounts. Doesn't matter. The main thing is that you have 3 or 4 cups of that tea a day. And, in hay fever season, that and the vitamin C are my go-to. So you can see how these remedies all interact. So they're just a couple of littlies for dealing with a few of these common symptoms we're seeing at the moment. But the other thing that we're noticing, not just the latest round, but the last 2 years, is people who feel pretty awful after they have even a mild infection. Now, something that's been around for however long that we've probably had viruses is a post-viral syndrome. It's something that we've seen really commonly with, somebody's had glandular fever, and that might turn into something where they never feel as well again, or even develop ME/chronic fatigue syndrome. What I've learned from 30 years, and I'm actually going to put a little shout out and say, any day now I'm hitting my 30th anniversary in clinical practice. I will have to make a video about that. There won't be balloons because they're ecologically unsound now, but 30 years is a lot of thousands of clients that I've seen over the years, and I don't know how many people I spoke to on air at Triple R on Talkback over those 20 years. But the thing that we know about what might turn somebody having a mild or severe virus into a post-viral syndrome is how you take care of yourself through the acute phase and that subacute phase after. We are not great with rest. How many decades have we had that message of soldiering on if you have a cold or a flu? And naturopaths shout from the highest rooftop that actually that's the last thing that you want to do. You want to rest. You really want to rest. Now, with so many people working from home, it's even harder to rest when you had a cold or something infectious and you say, look, I really can't come into work. People understood. Now you're expected to work from home. And I would say if you have to work, you really need to keep it to an hour, but you need to rest. And don't just go from not working to working a 50-hour week. That's how you're going to knock yourself out. So convalescence, once again, at jillstanner.com.au, if you type in convalescence, I got an article I wrote a while ago about convalescence. It is like, you're getting better when you get bored. It's a bit like if you've got a wound and it goes from being sore to being a bit uncomfortable to being itchy. It's that itch that tells you it is getting better. The same with boredom with convalescence. It's a great sign that, you are getting better, but it's like you're not quite there yet. So scale your return to work, scale your return to activity, especially exercise, walk before you can run, quite literally. And understand for everybody, this is really challenging. If you've got children at home, if you run your own business, if you have deadlines, if you're a performer and you're finally getting back out there again, you don't want to take time off to convalesce. If you can't do that, I think you probably should think about some really tailored nutritional and herbal support, but we would still say nothing replaces rest. And good food, your flour, your sugar, your dairy is not a friend when you're congested, when you're sore. This was meant to be a super quick live, so I've probably talked for long enough. It's lovely to be back here on the live, and it's really delightful to see you again. And I'm waving back at all the waves on Insta and Facebook Live, and I will see you again soon, and maybe I'll have a little mini celebration eventually. So take care. You can contact me at coaching@jillstanner.com.au if you have anything you'd like to ask me. Have a great day, folks. And I will remember, because it's so long, how to actually get off these things.